screen-induced dry eyes, insights from a tertiary care hospital in the East Singhbhum. So, dry eye disease is a multifactorial disorder of the tear film causing ocular discomfort, visual disturbance, and reduced quality of life. Its prevalence in India ranges from 18 to 54%, with rising cases among young population due to prolonged digital screen exposure. Excessive screen time leads to reduced blink rate, incomplete blinking, and meibomian gland dysfunction, resulting in tear film instability and inflammation. COVID-19 pandemic further escalated digital device use for work, education, and leisure, amplifying the burden of dry eye disease. Aim to determine the prevalence, severity, and risk factors of dry eye disease associated with excessive screen time in patients attending the ophthalmology OPD. It was an analytical cross-sectional study done in MGM Medical College, Jamshedpur, from May 2023 to 2024, October. 200 participants aged 10 to 60 years selected by convenience sampling. OPT attendees with consent residing in East Singhbhum were selected, and exclusion criteria was allergic conjunctivitis, corneal eyelid abnormalities, contact lens users, medications causing the dry eye disease. Data collection was using the structured questionnaire, socio-demographic, screen time, hygiene, and comorbidities were selected. Symptom assessment via the speed questionnaire, clinical test via Sharma's, TBUT, and meibomian gland evaluation was done. Analysis via the SPSS software. These were the tests done: meibomian gland dysfunction and the TBUT, Sharma's, the slit lamp positive test, and meibomian gland dysfunction using the slit lamp, the thickened palpebral margin, and telangiectasias. Results: screen exposure, 91% reported regular digital screen use, majority were 3 to 7 hours per day, and symptom severity according to the speed score: mild 31.5%, moderate 22%, severe was 46.5%. Clinical test done: Sharma's positive in 31%, aqueous deficiency, TBUT less than 10 seconds were 47%, tear film instability, and meibomian gland dysfunction 26 to 29%. Predominantly 18 to 30 years age group 56.5%, and 10 to 18 years age group were 17%. Females 52.5%, 60% were educated, more than equal the senior secondary, 50.5% students, and associated risk factors were urban residents, increased risk of meibomian gland dysfunction, and poor eyelid hygiene, increased the odds of dry eye disease. Comorbidities were headache, xerostomia, thyroid, and rheumatoid disease. Conclusion: high burden of dry eye disease. Nearly half of the participants experienced severe dry eye disease symptoms, highlighting a significant public health concern. Young and urban population at risk. Most affected were students and young adults 10 to 30 years with prolonged daily screen exposure. Screen time as a key driver. Dry eye disease is strongly associated with more than 3 to 7 hours of daily digital device use, inadequate breaks, and poor eyelid hygiene. Low awareness and treatment uptake: only 20% used lubricating eye drop despite the significant symptoms. Early screening of the high-risk groups, students and professionals, promote screen hygiene practices, increase awareness and access to treatment, and address environmental systemic comorbidities. So this study highlights the rising prevalence of dry eye disease in a predominantly young urban student population, strongly linked to prolonged digital screen use. Nearly half of the participants had severe symptoms, with objective tests confirming significant tear film instability, aqueous deficiency, and meibomian gland dysfunction. Gender, education, and occupation showed no significant statistical association, but urban residents, poor eyelid hygiene, and systemic comorbidities increase the risk. Low use of lubricants despite high symptom burden reflects poor awareness and treatment uptake. Findings align with the global trends of digital eye strain and emphasize the urgent need for preventive strategies, early screening, and public health awareness in the digital era. These were the key findings. Screen use more than 3 hours per day, 84.5%. Digital screen users, 91%. Severe dry eye disease, 46.5%. Sharma's positive, 31%. And TBUT less than 10 seconds, 47%. Meibomian gland dysfunction was 26 to 29. Thank you.
Thank you, Dr. Indrani. So you want to ask some question? So so you have diagnosed the screen related, that is generally what we call as computer vision syndrome.
Computer vision
So
syndrome.
what is the treatment protocol you decide like while choosing lubricating drops? So there are a lot of lubricating drops, classes of lubricating drops which are available in the market. So how do you proceed, like if you want to give some drops to the patient? So how do you choose which drop to be given to which patient?
So I kind of follow up is done like in 1 month. First the CMC carboxymethyl cellulose, and then I go for the sodium hyaluronate or cyclosporin like drugs for the severe ones.
So I think the cyclosporine, it is having a very these drugs, cyclosporine. If you have seen patients of Sjogren syndromes or very severe dry eye cases, in case of rheumatoid arthritis, so cyclosporine generally we don't start in the initial phase, and I haven't started any patient of mine on cyclosporine, because first thing is it's a very expensive drug, or initially what we do is I start these patients, I tell the patient to have a proper brightness, reduced brightness, and follow the 20/20 rule, and whether they can't avoid the screen, whenever they should do that. And lastly what I do is I start the patient on sodium hyaluronate. So it's a very good drop, and lot of patient have a very good result with sodium hyaluronate. I think you should also, you are doing this study, you should also try to separate these groups in further subcategories, and start some each group to a different line of treatment, and you will be able to know which drug is doing better in these cases. That can be done by you
Yes.
guys. Good, very
Okay.
good.
Thank you.
Another another fact is just preventing my ask just ask the patient to have plenty of oral fluids in any form, maybe simple water, any. So that also plays a good role. And another preventive is not to expose directly to the AC, screen and AC, air condition. That also is one of factor creating dryness.
Yes.
Thank you, Dr. Indrani, for a wonderful presentation.